reading medical papers. The title of this article is Effect of Remote Ischemic Conditioning on Electrophysiological Parameters in Non-Valvular Paroxysmal Atrial Fibrillation, the RIPAF Randomized Clinical Trial. Published in Heart Rhythm, 2019. Hello everyone. Today, I want to share a very special study with you. The topic is, can remote ischemic conditioning, RIC, reduce the occurrence of atrial fibrillation? It sounds quite technical, right? Don't worry, I'll explain it in a simple way so everyone can understand. What is atrial fibrillation? Atrial fibrillation, or AF, is a common type of irregular heartbeat. In Taiwan, Europe, and the US, about 2% of people experience this condition. AF causes the heart to beat irregularly, which can lead to palpitations, shortness of breath, dizziness, and even increase the risk of stroke and heart failure. Current treatments include two main options. Medications. These can have side effects and may not always be effective. Catheter ablation surgery. This works well but is invasive, costly, and carries higher risks. Because of this, researchers are looking for simpler and safer alternatives. What is remote ischemic conditioning, RIC? In simple terms, it involves using a blood pressure cuff to tightly compress the arm, temporarily cutting off blood flow, then releasing it. This cycle of brief ischemia, lack of blood flow, followed by reperfusion activates the body's protective mechanisms. Studies have shown this method can protect the heart and kidneys and reduce inflammation. This study aimed to find out if it could also reduce atrial fibrillation. How was the study conducted? The Heart Center in Leipzig, Germany, carried out a clinical trial involving 146 patients with paroxysmal atrial fibrillation who were scheduled for catheter ablation. They were divided into two groups. RIC group. The blood pressure cuff was inflated to 200 millimeters of mercury for 5 minutes, then deflated for 5 minutes, repeated 3 times. Control group. The cuff was inflated only to 10 millimeters of mercury, essentially a sham procedure. Before surgery, doctors used electrophysiological testing to try to induce atrial fibrillation and see which group was more susceptible. Research findings. Atrial fibrillation, AF, is less likely to be triggered. Control group. About 47% of participants experienced induced AF. RIC group. Only 23% did. This means the risk was reduced by more than half. AF is also less likely to persist. Control group. 33% had AF lasting over 10 minutes. RIC group. Only 15% did. Improvements in cardiac electrophysiological parameters were observed. The RIC group showed lower atrial irregularity. Atrial conduction delay was shorter. This indicates smoother electrical conduction in the heart, making irregular heartbeats less likely. Why is it effective? The occurrence of AF is related to uneven electrical conduction in the heart. If the refractory periods vary too much across different parts of the atria, it can create reentrant circuits, leading to arrhythmias. RIC helps reduce these differences, stabilizing conduction. Possible reasons include protecting mitochondrial function in heart cells, modulating gene expression, such as microRNAs, improving connections between heart cells. What does this mean for the general public? RIC is a simple, non-invasive method. It requires no surgery or medication, just a blood pressure cuff. In the future, it could become a way to protect the heart at home. Of course, current research is preliminary and more large-scale clinical trials are needed to confirm these findings. Conclusion. The cardiac preconditioning method RIC involves repeatedly inflating a blood pressure cuff on the arm. It stabilizes electrical conduction in the heart, reducing both the occurrence and duration of atrial fibrillation. This is a simple and potentially promising approach that may help many patients with AF in the future. So, the key takeaways today are: atrial fibrillation is common, and treatment options are limited. RIC is a simple arm cuff technique that may help reduce AF. The research results are encouraging but require further validation. Thank you all for watching, and see you next time. Do people truly believe that healthy medicine and RIC can promote wellness? Hurry and purchase a healthy RIC sphygmomanometer to enhance your health every day. Don't forget to scan the QR code. Thank you all for watching. I am Dr. Andrew Shu Lee. Until next time.